Pregnant women have always been curious about the sex of their unborn child. The advent of ultrasound, its application into medicine, and the revolutionary changes in its resolution and function has led to the ability to assign a sex to these unborn children, thereby allaying the anxiety of these women, but with consequent emergent ethical, moral, psychosocial, and medical legal issues. Ultrasound is used in most parts of the world for prenatal sex determination. Indication for prenatal sex determination can be medical or non-medical. The medical indication for its use include in families at risk of X-linked disorders, testicular feminization syndrome, pseudo hermaphroditism, genital anomalies, ambiguous genitalia, and determination of zagosity in multiple pregnancy. The non-medical reasons given by women for sonographic sex determination include preparturition shopping, curiosity of husband, relatives' request, and to confirm suspicion. First trimester sonographic prenatal sex determination can be done from 11 weeks gestation, using the direction of the genital tubercle and the sagittal sign. The downward direction of the tubercle is considered a female, while the upward direction a male. In sagittal sign, examination of the genital region in the midline sagittal plane demonstrates a caudal notch in females and a cranial notch in males. Ultrasound scan done in the second and third trimester places emphasis on visualization of the anatomy of the genitals or pelvic structure in determining the fetal sex. In the early publications on sonographic prenatal gender assignment, male sex was identified by the presence of the penis and scrotum, while females were by the absence of both scrotum and penis. But with improved modern ultrasound resolution technology, visualization of the vulva, clitoris, and labia is considered a female fetus, whereas demonstration of the scrotum, penis, descended testicles, and penile midline raphe is assigned to males. Visualization of the internal pelvic structures of the fetus, such as the uterus and ovaries, also assists in assigning appropriate sex to the fetus. Unfortunately, first trimester ultrasound sex determination has significant false negative rate. Studies done in the second trimester have better sensitivity values. The sensitivity of sonographic determined sex is dependent on the operator, machine, and habitus. Improvement in the sensitivity value increases with high proficiency and experience, as well as high-quality machine. Incorrectly determined sex can have some psychological effects on the family. Hence, an attempt must be made to place an accurate sex type on the fetus. While every woman is different, you may have several ultrasounds over the course of the first 20 weeks of pregnancy. But it's only at your mid-pregnancy ultrasound, usually done at week 20, that medical providers think an ultrasound technician is generally able to see baby's genitals and can let you know if you're having a boy or girl. The chances of an error with ultrasound are up to 5%. An ultrasound can be between 95 to 99% accurate in determining sex, depending on when it's done, how skilled the sonographer is, and whether baby is in a position that shows the area between their legs. Mistakes can also be made. Sometimes a loop of umbilical cord protruding in that area may be mistaken for a penis, sometimes due to presentation and lie. Baby is not in a favorable position to determine the gender. If this is the case, it may be necessary for you to return for one further scan appointment when hopefully baby will be in a more favorable position. It is not impossible to get a baby's sex in a breech position, but rather it is challenging, especially with third trimester pregnancies. There are two ways a girl can be mistaken for a boy in early ultrasound photos. The first is simple. The ultrasound tech or doctor sees an umbilical cord between the legs and mistakes it for male genitalia. This can actually happen at any gestational age, making a clear image pretty important, especially if you plan to buy non-neutral gender baby goods. During the early weeks of external gender development, both male and female babies have a dangly part down there, as well as a bulbous area. Somewhere between 9 and 12 weeks, the dangly part in the center forms the clitoris of a girl or the penis of a boy. It's less common to be told your baby is a girl, based on a gender scan and actually end up with a boy, but it does happen. For example, if the image isn't very clear or from a bad angle. There may not appear to be male genitalia even if there is. Inexperienced tech often assume no penis means a girl. For a confirmed girl ultrasound, typically, you want to see 3 lines indicating the shape of a vagina. Again, this is why 3D ultrasound is generally more accurate in predicting gender. Please subscribe.